The South African Medical Association says the Eastern Cape's Health Department needs urgent intervention. In a strongly worded statement, SAMA says it's alarmed at the severe lack of leadership in that province. The organization says there are no permanently employed leaders in all critical posts. It says this seriously compromises delivery of health care to the province. For more on this, we're joined now by the organization's chairperson, Mvuyisi Mzukwa. Thanks for your time, sir. We appreciate it. So you're not happy with the state of affairs in the Eastern Cape, but the health minister was there last week. He didn't seem too concerned.
Good afternoon, Shahan, and good afternoon to your viewers. First correction, I'm the vice chair of the association. Yes, we are concerned because from what we've gathered from our members, that there is a leadership crisis in the province because there is, persistent acting positions, for critical posts. And we don't believe that if you have unstable leadership at that level, you are going to be able to press on and fight, the scourge that we are facing as the country. But on top of that, I don't believe that the leadership in the Eastern Cape, especially government officials, including politicians, that they are really taking this fight seriously. I mean, for us, it is very serious because we've already lost our colleagues, healthcare workers there. We've lost doctors. We've lost Prof. Pepeta there, one of the critical leaders. We have lost nurses. We've lost, everybody that is in the front line in that province. So we are really not really in a position to just treat that condition or that crisis with the kids' gloves. Yeah. We are really believing that, if there was any consideration by the leadership, that they be all there to advise that province, that the first thing that you do is to address leadership, because that is going to coordinate the functioning of the province, especially to address the issues of coordinating the services in the province and also adding the numbers. The MEC is excited that, there's availability of beds. But those doctors are exhausted. Those healthcare workers, including nurses, everybody there is exhausted. There is no support, to say that let's organize some psychological support, and debriefing. But there's no such a thing. But you've got people who are excited that they've got the resources, as if healthcare workers work like machines.
Yeah. So outside of the strongly worded statement that you've issued, what can you do and what pressure can you put on government to actually fix the situation there?
One, we want to, put our hand on the deck by assisting in the province. And we're calling upon our members to assist, through the MSF, to assist the province. But also, let the minister not get there to go and sleep in a hotel. Let the minister speak to the people on the coalface. Let him speak to the healthcare professionals directly. This thing of going there and speaking to the top officials and leaving it there, it does not work in the province. I can tell you that is not given the correct information of what is happening on the ground. We are seeing this. We get it directly from our colleagues, from our members who are on the ground. So this thing of going, on an official trip is not helping the province.
Yeah. So tell us about your workers a bit more and what they're saying, because you obviously say that most hospitals don't have enough staff members, it's inadequate, healthcare workers are exhausted and stressed and frustrated. So what sort of conditions are we talking about here, which you clearly say is unacceptable?
I mean, your own colleagues, Shahan, have recorded and have shown the nation what is happening in the Eastern Cape. There are pictures, there were visuals that were out there in the public to see for themselves that what is portrayed officially is not what's happening on the ground. And what we see is colleagues who are now complaining that, because there's shortages of staff members, they're expected to do more. But on top of that, you've allowed alcohol to come into play. I mean, not only that you are dealing with COVID-19, but you are also dealing with alcohol-related injuries, which are taking their own time. I mean, to resuscitate a patient who is involved in a car accident and is also drunk on top of that. I mean, the step wounds and all those things. I think it was, as we understand it, it was a great mistake that you can allow alcohol, in the midst of a pandemic. And even if you think we're out of it, it has proven itself we are not out of this thing. Yeah. We need to put our heads together and say, what is it that is causing these super spreaders? We can't just leave it like that and think that everything is going well. People are dying, patients are dying, healthcare professionals are dying, but on top of that, they are getting exhausted.
All right, thank you so much for your time and the insight. Appreciate it. That was the South African Medical Association's vice-chairperson, Mvuyisi Mzukwa.